All right, thank you for staying with Daybreak. We're starting the discussion right now. We'll take a look at the dailies and hear their views with us, but mostly we're going to focus on the medical crisis, on the medical dilemma. The doctors are back to work, but the clinical officers and the lab techs are still not back to work. The medical interns are also still not happy with the deal that was gotten. We'll talk to them here and hear from them directly. Kennedy Okongo is here, is a Medical Credit Fund Director, East Africa. Thank you for making time. Peterson Wachira, Kenya Union of Clinical Officers Chairperson, is here. Asante sana for making time. And Dr. Mwinde Nthusi, Medical Officer Intern. Thank you very much for making time. Still waiting for Nicholas Odipo, is the Kenya National Union of Medical Laboratory Officers Chairperson. As soon as he comes in, we'll drop him into the discussion. And I'll start with you, Wachira. Let's take a look at the dailies first before we get into the matters medical world. We see here Ruto to splash 1.6 billion on state houses and lodges, deep state house repairs for money. What are your views on the current conversation that is ongoing on the finance bill? Are our priorities set right or not?
Thank you, Trevor, and thank you for having us here. Let me start by saying that we really feel that we do not prioritize the critical sectors that we should actually prioritize. And in that, of course, I must start with the healthcare. We are seeing a lot of taxation. We are seeing rise in taxation each and every year. As a worker, as a labor relations advocate, and even beyond the health workers, we are really a worried lot. And this is because for the first time in history, we are seeing taxation being levied on the entire salary. You know, the tradition has been that any taxation that is levied upon us, then it's usually on the basic salary. But now when you levy a tax on the entire salary, so we are having duplication of taxes. Because you'll have these introductions of taxes every year. You are taxing, let's say, a house allowance, because we are given a house allowance. But on the other side, you're also taking tax from the person I rent from. And that person is, of course, going to increase my rent so that they can be able to cater for the same. My commuter allowance is also subject to the housing levy. But then, in that commuter allowance, when I'm paying that bus fare, or if I'm fueling my car, I'm still paying that tax through the fuel. And so we are overtaxed, especially as the public workers. And really, it is impoverishing us. But now coming to the issue of spending. We really have an issue with the healthcare. And we know that healthcare is one of the pillars or facilitators of socioeconomic development. Because for you to socioeconomically develop, your people must be healthy. The amount of money that we are taking to India and other countries, it's in billions. If that money was invested in country, we would actually be collecting more taxes, and we would probably not be looking at the pay slips of the workers to continue impoverishing them. Because, of course, we know that the reason as to why we are going outside this country to seek medical attention is because we have not been following the path towards the Vision 2030. And our expectation has been that we have a vision that was laid down during His Excellency President Kibaki's time. May God rest his soul in eternal peace. And we said that by 2030, we want to see a country where we have medical tourism, where people come from all over the world to seek medical attention, because we are going to have specialized hospitals. We are going to have specialists who will not be found in any other part of this continent. But what are we seeing now? We are seeing allocation in other areas. And by that, Trevor, because I've seen probably around 7.9 billion will be used on State House, and about 4 billion on a renovation of state lodges and state houses. And I have no problem with that, because, of course, there must be a reason. But the reason as to why, for example, clinical officers are still on strike is because the government is saying that they do not have less than $1 billion, around 900 million, to enhance the risk allowance. the reason as to why our patients are suffering down there is because they cannot get drugs in the hospitals. We cannot get vital equipment in the laboratory so that we can be able to test our people. The reason as to why we lost a clinical officer who was working under the TB program under the Global Fund to depression and actually even took her own child is because the government was saying they don't have money to equalize with those on PNP, yet these people have been working for over a decade on contract, but you are told there is no money. The reason as to why we are on strike is because the universal health coverage staff, they need around 7.9 billion to be put on permanent and pensionable. 8,500 Kenyans and youth and hustlers that we said that we want to support our hustlers. We are told that that money is not there, and that is one of the reasons we cannot be able to get a deal. And it's also a reason that we continue discriminating a part of health workers who are also hustlers, as we coined it, and of course, who supported this government to come in. And that is why, for me, in my own opinion, I see that we really do not put the money where our mouth is, and especially where it's going to come back and give us more in terms of taxes. Okay. And another thing, when you're talking about the, is it called the vehicle circulation tax or something? Yes. You know, if you look at the countries where you have this kind of taxes, the cost of purchase of the car is actually very cheap. Okay. Because they either manufacture, and you'll get a zero mileage car at a very low cost. And now this encourages more people to be able to buy these vehicles, and then you are going to get more taxes as you levy. Okay. But now what we are doing, because we are discouraging Kenyans from actually buying vehicles, so in future, the taxes we get from fuel is going to go down.
Okay.
Yes.
Kennedy, let me hear from you. Are our priorities set right?
Thank you, Trevor. Just looking at where the country is going, our priorities could be right, our priorities could be wrong, depending on which side you're looking at it. Taxes are there and they are meant to help the country grow. Taxes are meant for the citizens to feel like if I am contributing X amount of money from my salary, then I'm also getting something in return. For example, let's talk about the car tax that's coming in. Right now, if you are to import a car, because a majority of our cars are imported, 60% of the cost of that car is actually taxes. So then you start imposing another tax on tax. If I'm bringing in a car worth 1 million, probably the purchase price is 400,000 Kenya shillings, and 600,000 goes into taxes and taxes and taxes. So when the car reaches Nairobi and is valued at 1 million shillings, it means I'll be paying every year tax on tax until the vehicle is fully depreciated. If you look at what we are currently doing in the country, refurbishing the state lodges, which is actually a good thing. We believe our president needs to reside in a very posh area. He's the head of state. But do we need the 9, 10 state lodges? How many of them can the president visit even in a single year or even in a 5-year term? How many of them then can the president actually stay at? And do we need them to be that lavish? If we have 1 billion shillings annually for the state lodges, and yet doctors are going on strike, teachers are now going on strike through the internship program that we have for teachers that cannot even be absorbed. The medical interns, it's a complete nightmare that we're having. So the question is, what are our priorities? We're just coming in from floods that have ravaged this country. And the people who unfortunately were displaced by the floods, they were promised some stipend by the same government that's going to spend 1 billion shilling in refurbishing these state lodges. So then you ask yourself, what is the priority? If I cannot compensate somebody who's been ravaged by floods, they're still living in school compounds, schools that are supposed to have reopened right now. So you have students reporting to school, you have displaced families living in the same schools, and yet we are putting money to refurbish our state lodges. On the other end, we have a national health insurance scheme that's not compensating hospitals. So if Kenyans will get sick, you know that there's nowhere you are going to go to any help in the hospital sector because NHIF is not paying any claims to the health sector. Doctors are on strike, but yet we have money to put in the wrong places. This morning, my ride from where I stay to this place is around 20 kilometers. Out of the 20 kilometers, actually, Trevor, there is no road. The best part of the road is where you come in across closer to your offices because you live closer to the who's who in this society. But beyond that, we struggle with our jalopies on this road just to be here in the morning, just for you to go serve the nation, just for you to go pay the taxes that the government needs. You're not given the capacity to be able to do that. You struggle in the car because the cost of repairs of that car is extremely so high. Medical is already gone through the roof. You have to go and seek private health or go out of the country. How many of us can afford this? Yet the money that we're having, we are putting it in the wrong place. Okay. So it will be good to tax Kenyans, yes, but in return, let's see something for the taxes that we are paying.
Okay.
Thank you.
Dr. Ntusi, what are your thoughts on this?
Well, my thoughts on this matter, there's actually a saying, or rather a statement that basically states that it's quite difficult to tax a nation into prosperity, but at the same time, investing in a country's health is actually the best way to attain that country's wealth. When it comes to the current fiscal policies that our government has actually enacted, the proposed financial bill and the additional taxes that my brother has actually pointed out, and senior colleague, it's a bit tricky in this regard. We really feel the austerity measures that are currently in this economy, and whenever you're trying to tax and increase revenue in a country, you should always try to balance, because you also run the risk of taxing people so much that you actually deplete and minimize investment, which now curtails the growth of the economy. Because the V velocity, which is literally what keeps the wheel of the economy turning, is quite delicate. So whenever you overtax and basically increase taxes, it actually has an effect on that. And if you decrease that V velocity, then you actually decrease the growth of the economy. So that's my view on basically the fiscal policies that our government has actually enacted and the taxation measures. But when it comes to spending, my view is quite similar to what my senior colleagues have pointed out. Health is quite important. If you look at the amount of money that should actually go into health, I'm always of the opinion that it should be increased. Because if you look at our healthcare workers, all healthcare workers, it's a bit different when you think of health and compare it to other industries, whereby 70% of the money should actually be going to the healthcare workers and not the infrastructure. Because when you go to a hospital, you might have equipment, you might have buildings, but at the end of the day, if you don't have the personnel, the doctors, the nurses, the clinical officers, the medical lab scientists, and everyone, including the support staff who actually make the place clean and decent, you won't really be able to achieve good quality healthcare. But if you just have machines lying around, then you don't really have anything. So that's my view on that.
Okay.
And
all right.
Yes.
So we'll delve deeper into that, but let me hear Odipo's views before I take a quick break and then come back and talk about the crisis in the health sector now. Odipo, what are your thoughts on the finance bill? It's a conversation that is open now for the public.
Trevor, I think we have a very insensitive government in that you cannot tax people into prosperity. And more so, when you tax and then there's no investment of those taxes. Last year, or the ending financial year, that is this year, the raft of taxes that were brought, and people really felt the pinch of those taxes. But if you walk around, there's no any new development that is being done. So sometimes, as a citizen, you ask yourself, why should we continue paying taxes or continue paying increased taxes, yet the services that we as the citizens of this country are not getting? For example, my colleague here has talked about NHIF. NHIF right now is like a moribund institution. It is not helping the citizens of this country. If you look around the floods that came there just the other day, a whole president is going there and telling people that I'm going to give you 10,000 shillings for 3 months to go and look for houses. What about the other things? The school fees, the food, the personal effects that were swept by the floods. Yeah? And in that case, you find that there's money that is being set aside for renovations and some luxury cars, traveling. And today when I was coming, I saw a certain figures that were given to the Deputy President, whereby 825 million are supposed to be confidential. So you ask yourself, if this money is coming from the citizens of the Republic of Kenya, why is it that money is given to someone and it becomes confidential? What do they want to do with that confidential money? Yet the healthcare workers are on strike. So we really need to ask ourselves questions as citizens of this country. Because you cannot be made to pay taxes and those taxes are not helping you. The only thing we are seeing are people building high-rises, people living lavishly. The money that the healthcare workers are asking is very minimal compared to what these people are going to use. If we could be taxed and then we are feeling the effect of those taxes, we have no problem to paying taxes because this is our country, we must be patriotic to it. But if you are taxing us and we are not feeling the effect of the taxes, we'll always complain. So on this financial, the new finance bill that is being brought, I think citizens should now start uprising. Okay. Yes, because we are not going to accept a government that is not listening to the people, but they are listening to themselves.
Okay.
Yeah, that is selfishness and greed, and we must speak very strongly about it.
Okay.
Yes.
I have to take a quick break here. When we come back now, we get into the medical field and the medical crisis currently. We'll take a status of the situation through the experts who are with us here, the union leaders, and find out from them. Are they on strike? Are they not on strike? What is the stalemate all about? All right? And Trevor Mbidi at Citizen TV Kenya. Use the hashtag Daybreak. We're just back in a few minutes. Right?